Hello everyone. Today I am going to discuss about the treatment of epilepsy. It is very much important topic for all India MCQs and also very much important topic for the practical purpose. There are lots of changes happened in treatment of epilepsy and also the definition of different types of epilepsy. So let's start with the discussion. First, we need to discuss about the types of seizure. Previously, there are only two types of seizure is present. One is partial seizure, one is generalized seizure. Now there are the definite types of seizure as defined as four types. One is focal, one is generalized, one is unknown onset seizure, and one is unclassified seizure. What do you mean focal seizure? Previously, focal seizure is also called as partial seizure. Now it is name changed and it is said as focal seizure. That means convulsion occurs in one part of the body, either on the head, on the or the hand or the legs. So it is focal seizure. If the convulsion occurs in both the hemisphere of the brain and the convulsion occurs in throughout all the body, then it is called generalized seizure. If the cause of seizure and the type of seizure is not classified by the history, then it is called unknown onset. And what do you mean by unclassified? Unclassified seizure is defined as if clinical characteristic of a seizure is unusual and determination of onset of seizure cannot be made despite adequate workup, the seizure is labeled as unclassified. That simply means if we do not characterize the type of seizure by the history, or we do not characterize the cause of seizure or the timing of the seizure, then we classify it as unclassified seizure. Now, the focal seizure is divided into two types based on the awareness, level of awareness. If the awareness is present or no alteration of consciousness occurred during the convulsion or after the convulsion and before the convulsion, then it is called focal seizure, focal aware seizure. And if the awareness is lost or the patient is unconscious during the convulsion with focal conversion, then it is called focal with impaired awareness. Previously, it is called about as complex partial seizure. So it is also an MCQ. So complex partial seizure is now, the term is focal seizure with impaired awareness. Now, what is the definition of epilepsy? Epilepsy is defined as when two or more unprovoked seizure occurs in a time of longer than 24 hours, then it is called epilepsy. Or if occurrence of one unprovoked seizure with either a second that type of seizure or EEG or clinical information shows recurrence, then we tell that it is an epilepsy. In a simple language, if a patient having two seizure more which occur 24 hours apart, then we call the child is suffering from epilepsy. That means if a patient having convulsion on day 1 and if the patient having convulsion on day 5, then the child is suffering from epilepsy. Now, the term seizure disorder. So seizure disorder is a general term. Everything is present in under the seizure disorder. That is, it includes epilepsy, febrile seizure, epilepsy syndrome, provoked seizure, single seizure, etc. Unprovoked seizure and genetic seizure. Everything is under the seizure disorder. So what do you mean by provoked seizure? If the cause of the seizure is known, or if that means if the Seizure is due to electrolyte disbalance or meningitis or brain infection or due to any intracranial hemorrhage or intracranial tumor. That means the cause of the seizure is known, hypoglycemia, then it is called provoked seizure. What do you mean by unprovoked seizure? If the cause is not unknown, is not known. If the cause is not known, then it is called unprovoked seizure. Now, the definition of epilepsy syndrome. So, what do you mean by epilepsy syndrome? Epilepsy syndrome means it is a syndrome. That means there are lots of clinical features, clinical symptoms apart from epilepsy or conversion. That means one or more specific type of conversion with specific of age, onset, and specific prognosis with specific other features. That is called epilepsy syndrome. It is a clinical syndrome, not only a specific type of seizure, as I said. If a child having only focal seizure without any other clinical features, then the child may not have epilepsy syndrome. So, if a patient having focal seizure with some delayed developmental milestone, then the child may suffering from Dravet syndrome or other things. So, epilepsy syndrome means there is a specific times of onset of seizure, specific type of seizure, or specific age or onset of seizure, and specific prognosis. Along with there is a specific other clinical features may be present. What do you mean by epileptic encephalopathy? Epileptic encephalopathy is defined epilepsy syndrome with abnormal EEG that cause cognitive and behavioral impairment. So, if a patient having conversion and that causing abnormal EEG and that lead to behavioral impairment, then the child is suffering from epileptic encephalopathy. Now, what is the definition of febrile status epilepticus? So, as the definition of febrile seizure, that conversion is last less than 30 minutes. Less than 15 minutes. So, if a patient having suffering from convulsion less than 15 minutes at a time interval between 6 months to 60 months, and if it is DTCS in nature and it is last for less than 50 minutes, then we tell the child is suffering from febrile seizure. But if the conversion is DTCS and if the conversion is last for more than 30 minutes, then we tell the child is suffering from febrile status epilepticus. Now, what is the definition of FIRES and what is FIRES? As I said in my previous video, FIRES is the term FIRES means fever-induced refractory epileptic encephalopathy in school-going age children. That means the child having fever with refractory encephalopathy in school-going age children. The main features are, these all points are all in the MCQs. It is mainly male predominance is seen. It is predominantly occur more than 5 years of age. It happens after the epilepsy start, after the fever start, and infectious prodrome is mainly present 2 weeks to 24 hours before the onset of conversion. And encephalitis like illness is the child is suffering from. That means the one episode of fever and the child having refractory conversion and the features of encephalitis, like that means headache, neck pain, and there is irritability, and also the child is having poor GCS. The drug of choice, the treatment is only ketogenic diet. Now, what is the definition of genetic epilepsy? Genetic epilepsy means the epilepsy syndrome is directly result of some genetic defect. Just as example is Dravet syndrome. The gene is SCN1A. There are lots of other genetic epilepsy, but it is comes in all India MCQ. Dravet syndrome. I will tell about Dravet syndrome in a brief in my next slides. Now, structural epilepsy. What do you mean by structural epilepsy? If the epilepsy syndrome caused by structural brain defect, that means the child having old brain infarct or the HIV child is suffering from HIV or some tuberculosis, that means some structural problem present in the brain. Then if the child develops some convulsion or epilepsy, then we said that the child is suffering from structural epilepsy. Now come to the Dravet syndrome. What do you mean by Dravet syndrome? So Dravet syndrome is a genetical epilepsy. It is seen that the child having mainly focal conversion, and it is start in early infancy. That means it may start in 3 months to 12 months. Within 3 months to 12 months, the child is suffering from epilepsy. Mainly this type of children having conversion starts with the child starts with febrile seizure, and after that, after febrile seizure, the child may develop afebrile seizure also, and mainly the seizure is type is focal seizure. And after focal seizure, there may be presence of cluster of seizures like atonic seizure, tonic seizure, clonic seizure, or other types of seizure, and it is occur every monthly or 2-month interval, and the child having developmental delay, and the gene which is mainly causing this type of Dravet syndrome, the genetic gene defect is SCN1A gene. So it is an all India MCQs. The treatment of Dravet syndrome I will discuss in my next slide. And so it is mainly early onset. That means occurs mainly in the 3 months to 12 month interval, and the child having starts with a febrile conversion, and that is mainly focal conversion, and there may be child then, and it is goes beyond 5 years. As I said, febrile seizure is mainly up 6 months to 5 years. The child is suffering from, if the child is suffering from Dravet syndrome, then the child having conversion more than 5 years. Now, what is Landau-Kleffner epileptic aphasia syndrome? It is also an all India MCQ. So a patient may comes to you in the morning that the mother said that the child is cannot talk when she wakes up or he wakes up from the bed. So the conversion, due to the conversion at night, the child is suffering from loss of speech and verbal auditory agnosia, and it is due to activation of temporal lobe in the sleep, and the conversion is mainly temporal lobe activation. So the cause mainly autoimmune or genetical, and the EEG records spike only record in non-REM sleep. Though if that means if the patient is awake, then the EEG may come to normal. If the child is going to sleep, if the child is sleeping, then there is a burst of EEG seen, and it is mainly seen in non-REM sleep. So that's why we tell the patient to, or the neurologist to do the EEG during non-REM sleep only. EEG during awake position, awake time, the EEG comes to normal. So we need to tell the neurologist to do the EEG when the child is sleeping and when it is in non-REM sleep. And the drug of choice is prednisolone plus diazepam. As I said, it is mainly due to autoimmune disease or genetical disease. So we have to give prednisolone, and along with this we give night time diazepam. Now come to West syndrome. So it is also an all India MCQ. This West syndrome present mainly in the early age group of a child, that is mainly 2 to 12 month age group of child. The child having suffering from this C triad, that is infantile spasm, that means myoclonic type of seizure, and sudden shoulder drooping, neck drooping, or sudden different types of spasm. Infantile spasm occurs clusters and multiple times in a day. The child having developmental delay, and also regression of the milestone. That means the child may having some developmentally normal if before the conversion. When the conversion start and the disease is getting up, taking upward hand, then the child having regression of the milestone. And when we do the EEG, we found that there is a cortical is arrhythmia on the EEG. It is also an MCQ. So the triad is infectious spasm, developmental delay or regression of milestone with arrhythmia in EEG. That means high voltage, slow chaotic background with multifocal spike present in the EEG. Now come to Lennox-Gastaut syndrome. There is this patient is suffering from, if the patient is suffering from Lennox-Gastaut syndrome, then the onset of the conversion is typically 2 to 10 years age group. And the child having this triad, there is multiple types of seizure. That means the child may suffering from focal seizure or tonic seizure, clonic seizure, generalized seizure, or different types of conversion. There is multiple seizure types, and it is mainly generalized. Generalized seizure is mainly seen in Lennox-Gastaut syndrome, and the child having developmental delay. And when you do the EEG, we found that 1-2 hertz spike and slow wave in with polyspike burst in sleep and slow background in wakefulness. This is the all-India MCQ. So the triad is multiple seizure type, developmental delay, and the classical EEG finding 1-2 hertz slow waves, polyspike burst in sleep, and slow background in wakefulness. Now come to some different EEG finding. These all are all India MCQs. They shown the pictures of this, or they written this definition and tell you that what types of seizure the child may suffering from. That is, if the child is suffering from 3 hertz with slow wave, it is mostly seen during hyperventilation. Then the child is suffering from absence seizure. That means 3 spike with slow wave or 3 spike and a dome pattern. 3 spike and a dome pattern mainly seen in absence seizure. If the child is suffering from generalized periodic epilepsy from discharge, then this may be a case of SSP. SSP means subacute sclerosing panencephalitis, that is happened after measles infection. So generalized periodic epilepsy from discharge, if it is written in MCQs, then the child is suffering from SSPE. If the child is suffering from herpes simplex encephalitis, then the EEG finding is lateralized periodic epilepsy from discharge. That means temporal lobe is mainly involved in herpes simplex encephalitis. So there is lateralization of EEG epilepsy from discharge, mainly seen in periodic fashion. Now come to the anti-epileptic drug of choice for different types of seizure. These all are all in MCQs. So first line drug for generalized seizure, that may be tonic, clonic, atonic, or any types of generalized seizure. The first line drug is valproate, and the second line is phenytoin and or levetiracetam or lamotrigine. So you can keep in mind that VPL, that means valproate, phenytoin, or levetiracetam and lamotrigine. So if the child having generalized seizure and the child is suffering from liver problem or the child is suffering from any metabolic disease, then the first line drug of choice is levetiracetam, not valproate. So if the child is suffering from liver problem with generalized tonic-clonic seizure, the first line drug is levetiracetam. If the child is suffering from absence seizure, then first line drug is ethosuximide or valproate, and the second line is lamotrigine, levetiracetam, or topiramate. So you can keep in mind like this. Evil, EVL, evil. So in absence, evil is come. That means if ethosuximide is not present in India. So if option ethosuximide is not there, then you can go for valproate. If the child is suffering from focal seizure, then the drug of choice is oxcarbamazepine or carbamazepine. So oxcarbamazepine or carbamazepine, second line drug is lamotrigine, valproate, phenytoin, and lacosamide. So you can keep in mind like this. OPL. That means oxcarbamazepine, carbamazepine, P for phenytoin, L for lamotrigine or lacosamide. If the child is suffering from epileptiform epileptic spasms, then the drug of choice is ACTH. So in West, that means in West syndrome, the drug of choice is West syndrome, drug of choice is ACTH. Second line drug is steroid or vigabatine. If the child is suffering from epileptic spasm with tuberous sclerosis, then the drug of choice is vigabatine. And second line drug is ACTH and steroid. If the child is suffering from myoclonic seizure, tonic seizure, atonic seizure, then the drug of choice is valproate. That means VEL, phenytoin, levetiracetam, or lamotrigine. If the child is suffering from Lennox-Gastaut syndrome, so first line drug is clobazam, and second line drug is valproate and lamotrigine. For Dravet syndrome, the drug of choice is clobazam again, and second line drug is valproate. So these all are all in MCQs.